Choosing a hip implant involves specific materials to your unique bone density and activity level. We have synthesized the latest clinical data to bring you this guide on behalf of the Best of Health, the UK's trusted resource for over 50s navigating healthcare decisions. The exact implant you select dictates the lifespan and physical feel of the joint. While these choices are significant, modern baseline success rates for these surgeries are remarkably high. You will need to weigh a specific trade-off, prioritizing proven immediate stability versus seeking the long-term durability required for a high-impact lifestyle. Evaluating your biological age and activity level against two mechanical variables will help resolve this trade-off. This image shows the two main components of the bearing surface, the ball replacing the thigh bone head and the socket lining the joint. The specific materials used here determine the amount of joint friction, directly impacting how the hardware wears down over decades. The second key variable is fixation, the method used to anchor hardware into your bone structure. The combination of a specific bearing surface and a fixation method creates your custom implant profile. Metal on polyethylene is the absolute gold standard and the most widely used implant combination in the UK today. This combination of a metal ball and a plastic socket has been successfully utilized in operating rooms since the 1960s. Modern, highly cross-linked polyethylene plastic makes today's versions durable enough to last 20 years or more for most patients over 60. Ceramic on polyethylene acts as a lower friction alternative, substituting the metal ball for a ceramic one to reduce the physical wear on the plastic liner. Research from the University of Bristol indicates this ceramic on plastic combination may be the most cost-effective option for physically active patients under the age of 65. Ceramic on ceramic implants use ceramic for both components, delivering the lowest wear rate of all available combinations. That extreme durability comes with specific trade-offs, including a rare risk of fracture and a small risk of audible squeaking, typically reserving it for highly active patients under 55. Metal-on-metal implants were popular in the 2000s, but they are now an outdated and broadly rejected option. The friction between the metal components can release ions into the bloodstream, causing local tissue reactions. Consequently, anyone with an existing implant requires annual NHS follow-up checks. While an all-ceramic joint minimizes wear for young athletes, highly cross-linked plastic remains the reliable choice for the majority of patients. Once the friction materials are selected, you must address how the implant achieves structural integrity within the leg. In a cemented fixation, specialized bone cement fills the gap between the implant and your bone to create an immediate load-bearing bond. Research from the University of Oxford shows that cemented implants provide modest but critical quality of life improvements. It remains the NHS standard for patients over 60. Uncemented fixation utilizes a rough, porous surface designed to encourage your body's natural bone to grow directly into the metal over time. This method relies on cellular regeneration to secure the joint, requiring the strong baseline bone density found in younger patients. National Joint Registry data reveals 97% of modern hip replacements function well at the 10-year mark, and 90% reach 15 years. This exceeds the 95% survival rate required by NICE guidelines to ensure patient safety. Ultimately, your natural bone density and age dictate the safest and most effective fixation method for your specific situation. The pathway you take through the healthcare system determines how much direct input you have regarding the implant type. Under NHS protocols, clinical teams typically default to the cemented metal on polyethylene implant for patients over 60. While the NHS limits custom choices, this standard protocol provides an implant with a massive and universally proven safety record. Choosing private surgery allows a direct, unhurried discussion with your surgeon to select specific, customized bearing surfaces together. Private patients also gain faster access to newer architectural designs, such as dual mobility implants meant to further reduce dislocation risks. The NHS offers guaranteed standardized reliability, while the private sector provides bespoke material options for specific lifestyle edge cases. This decision tree provides an actionable guide. Patients over 60 with standard activity levels generally align with a cemented metal-on-plastic implant. Active patients under 65 are often candidates for ceramic on plastic, while high-impact patients under 55 align with ceramic on ceramic or hybrid fixations. Beyond the materials, the individual skill of your surgeon and the correct anatomical positioning are vital to the success of the procedure. For comprehensive guides on care choices, detailed costs, and making confident decisions after 50, visit The Best of Health at thebestofhealth.co.uk. Please remember that this guide is for information only, and you must consult a qualified healthcare professional before making health decisions. A successful outcome relies on selecting the specific combination of hardware that aligns with your current biological milestone.